How do you know if you have scoliosis? Scoliosis is a structural spinal condition that involves the development of an unnatural sideways spinal curvature. To be diagnosed with scoliosis, the unnatural curvature must have rotation, making it a three-dimensional condition. And we know the scoliotic curvature needs to have a minimal Cobb angle measurement of 10 degrees or greater for it to be considered a true scoliosis or have a true diagnosis of scoliosis. Now, a Cobb angle is the gold standard in diagnosing and assessing scoliosis. The Cobb angle determines the severity of the scoliosis, meaning how severe the curve is. And the bigger the Cobb angle, normally the greater the severity. Now, when we diagnose scoliosis, we break it down into 3 categories, and I like to use 4. Now, these categories of scoliosis don't take into account the effect the scoliosis is having on the patient. It's only determining whether the case is considered to be a surgical level scoliosis or not. Mild scoliosis is between 10 and 25 degrees, and this is what the Cobb angle hits between those 2 numbers. Once you break 25 degrees, but less than 40 degrees, this is what they call this moderate scoliosis, and that's where the Cobb angle measurement would be. Once you break 40 degrees plus, this is where we call scoliosis severe scoliosis, and this is when they start considering scoliosis to become a surgical treatment option. But patients with severe scoliosis may have very little effects as a result of their scoliosis. So severe scoliosis doesn't necessarily mean having severe effect. It just means that the Cobb angle is greater than 40 degrees. Now, I also like to use a 4th category, and that's called very severe scoliosis. And that's when Cobb angles measure 80 degrees or greater. So like I mentioned, there is no actual degree that says at this degree you're going to have these symptoms or these problems, but we do like to say that the more severe the Cobb angle, the more likely the effects are going to be more noticeable for you. So as curves get bigger, they tend to cause more problems and lead to more situations. However, it's not across the board true for every single patient. The person's scoliosis is unique to them. The way it affects them is unique to them. There's not a global number here. So symptoms of scoliosis differ also among different age groups, meaning scoliosis affect different age groups different ways. The most common symptom associated with children or adolescents with scoliosis is only posture. We see posture deviation. We'll see things that affect the posture. In adults, we tend to see pain that normally brings on the diagnosis of scoliosis. So we know scoliosis can affect posture in adolescence because of the uneven forces and the way the spine dictates postural symmetry. As the spine shifts out of alignment, what ends up happening is through growth and through Hoover-Rockman's principle, which is the way the body responds to asymmetrical pressure over time, body position tends to change. We see asymmetrical rib development. We'll see asymmetrical pelvic development. We'll see uneven shoulders. We'll see the skull sitting different relationship to torso and pelvis. We'll see uneven hips. We'll see the arms hanging at different lengths. We'll see all these different postural misalignments that tend to happen, and even though the patient's experiencing very little discomfort or pain. And unfortunately, as these posture changes happen, and normally as these posture changes get bigger, normally that's a direct relationship to curve progression. Now, unfortunately, this curve progression tends to be associated with puberty, as kids go through puberty and as they tend to grow. This is the exact same time that most kids are starting to wear bigger clothing and they're covering themselves more often. So it's very easy to miss that there was something that wasn't visual there before. And, a year later, as they go through a growth spurt and they go in for their pediatric evaluation, now they see a significant scoliosis. Kids go through rapid growth spurts, and therefore there could be very rapid progression. So we can go from a curve that's almost unnoticeable to a very, very severe curve, and the only sign is posture. There is never a time for there to be posture asymmetry and for that to be considered normal in an adolescent growing child. There should never be. So if you see any type of posture asymmetry, do not take that lightly. Have that further evaluated to see if there could be possibly any scoliosis developing. Now, in the adult stage, sometimes we can see posture asymmetry, but however, the most common reason why adult patients seek out treatment is because they're experiencing pain. Now, in adolescent cases, pain is not an issue. The biggest curve I've seen in an adolescent case has been 155 degrees, and that child felt no pain. When kids feel pain as a result of their scoliosis, it's normally a mild, dull ache, but they normally don't experience a significant amount of pain because the curve isn't resulting or causing pain because it's not compressing. It's because it's worsening because they're growing or elongating. In the adult form, curves progress now because of a compression of gravity over time. And as the spine compresses, it affects muscles, nerves, and tissues, which can cause pain. This pain tends to start off mild as a young adult, very easily dealt with, but unfortunately, as curves progress, they tend to increase the amount of pain they're experiencing. The amount of pain associated with the adult isn't directly related to the size of curve as a whole, but related to how much you progress as an adult. So theoretically, you can have, say, a 60-degree curve when you stop growing. You can hold your curve at 60 degrees your entire life, will cause very, very little pain or any very little problem. So however, if you stop growing with a 30-degree curve and progress from 30 to 40, that 10 degrees is more likely to cause pain. So a person with a 40-degree curve could have more pain than a person with 60 degrees. It just depends on how much they progress in the adult form. So the adult progression almost always leads to pain. Now, if you notice that you have signs of scoliosis, what are the first things that you should do? Well, number one, if you have any type of postural asymmetry as an adolescent, you definitely want to take your child to a professional to be assessed further. And typically the classic thing is we're going to see a left flat hip, we're going to see rib arching on the right, we're going to see uneven shoulders, we're going to see an unleveling of the arms and legs relative to each other, we're going to see some torso shifting. Anything that we definitely would want to recommend any type of further testing. And if the professional were to assess the patient and say, okay, what's the next step? Typically spinal x-rays are next. For the adult patient, you're experiencing pain and you know you have scoliosis, definitely have your spine evaluated and x-ray to see if the curve has progressed any. But also if you have any type of postural asymmetry and you're developing pain as the adult patient, see if maybe you had a scoliosis that you didn't know. Remember, the most common type of diagnosis in the adult patient is a patient who didn't know they had scoliosis, but experiences pain and has an x-ray and actually determined that they actually had adolescent scoliosis that never really progressed to a significant number to be diagnosed in the adolescent form. Once there's an x-ray determined and we actually measure the patient's Cobb angle, now we can determine the size of the scoliosis to see what size or severity the scoliosis is to help to determine the treatment option. And then once you're given those treatment options, then you can decide what type of treatment options you would shoot for, meaning more conservative approaches, trying to reduce the curve, because we always say the younger the patient, the smaller the curve, the better results we're going to have. However, at least you'll know there is a scoliosis and you'll be able to monitor it properly. In the very least, monitoring your scoliosis is definitely a form of treatment, making sure the curve isn't progressing. But we definitely recommend early diagnosis with early treatment always leads to better results. Thanks for watching. I hope you found this information helpful. If you'd like to hear about other topics and information on scoliosis, type in the comments below and let us know. And finally, subscribe and hit the bell icon to be notified of when we publish content. Thanks.